Texas has reported its first case of monkeypox, and it was confirmed in Dallas County. It's a rare virus in just one case, but it brings the total number of cases in the U.S. to 32, according to the CDC. There's a lot to uncover about monkeypox, including how it got here and what happens now. Matt Howerton spoke with the experts to get some answers.
The CDC taking action against monkeypox this week, bolstering guidance and precautions as global cases go above 1,000. And it comes.
This is our first case this year.
As Texas records its first case in 2022 here in Dallas County.
We've certainly interviewed the person, identified other individuals who had some direct contact with the patient, monitoring those persons for symptoms.
The patient is a male who tested positive Monday. Dr. Philip Huang leads the county's Health and Human Services Department and says the man recently traveled from Mexico to Dallas. Huang and his team working to notify passengers on the man's flight and anyone else who had close contact.
The patient is not hospitalized, is isolating at home.
Monkeypox is a virus spreading from animals to humans, primarily in rodents. People infected can give it to others through skin-to-skin contact or prolonged face-to-face contact.
You really have to have exposure close, and it has to be for usually 3 or more hours.
And if you're worried, Texas State virologist Rodney Rhodes says it doesn't spread as quickly as COVID-19 and the fatality rate is low.
This particular strain that's in the U.S. is about 1% or less. And as you may know, no fatalities have occurred to date.
Dallas County actually had a case of monkeypox last year after a man traveled from Africa to here, and the health officials here in the county were on top of it, notifying over 200 people who had come into close contact and monitoring their symptoms for 21 days.
That time passed and no one did develop symptoms, so it was kept under control.
Still, with a low threat, health officials are watching closely. In Dallas, I'm Matt Howerton.
As Matt mentioned, this week the CDC raised its advisory to level 2. That means if you're traveling to a country impacted by monkeypox, you should avoid contact with sick people as well as wild animals. A level 3 advisory would encourage Americans to avoid non-essential travel.